Hi everyone, Dr. Nemechek here. I want to just re-emphasize again about the amount of inflammation that leaky gut can trigger, and then what variety of things we're understanding can actually cause leaky gut. Now I'm going to talk about it in a general principle first by just the bacterial overgrowth that occurs. This is referred to as SIBO, Small Intestinal Bacterial Overgrowth. A lot of research papers just vaguely say dysbiosis, but this is kind of what they're implying. And so this slide you see here, this is our normal setup. We have these families of bacteria live in the small intestine. These guys live in the large intestine. Now the ratio isn't really correctly shown here. It's almost sterile in the small intestine. For every one bacteria here, you have 100 million in the colon. All right, so that's normal. Then we have SIBO, is this problem where you have normal bacteria in the wrong place. Now again, these are not like bad bacteria from tainted food or something. These are normal bacteria, often Klebsiella, E. coli species. And we know in adults at least, when you have overgrowth, it's one, maybe two species. You have, depending how you count things, we'll say you have roughly 1,000 species overall, but you only have one or two growing up there. Now, it's not built for that. It gets overwhelmed, and literally stuff leaks through the seams in a process that is commonly referred to as leaky gut syndrome. All right. We refer to this as intestinal permeability. That means permeating or going through the intestinal tract into the tissue out here. And these little symbols here, so this is interleukin 1, interleukin 6, and tumor necrosis factor alpha. These are three of the major pro-inflammatory cytokines that get released when you have leaky gut. And it is hard to overstate how much inflammation gets released here, and I want to show you why. So now I'm going to show you like a cross-section of the small intestine here, all right? And this, now, this isn't a human, this is a mouse, but you know, you can get a mouse on a slide, on a small microscope slide, so I wanted to use this. So ours were built the same. It's just these folds here we call villi. In humans, they're smaller, all right? But otherwise, it's built the same. Now, normally, very few bacteria up here. And so nature only gave us this little barrier here that runs along, is only one cell thick. It doesn't need to be very thick because there's not much in here you have to control normally. Now, you get SIBO, you have 10,000 to 100,000 times the bacteria up there, and stuff will start leaking through into this space here, what we call the lamina propria. And there's also what are called Peyer's patches in there. But anyhow, in this space is 70% of all your white blood cells. 70% of all the immune cells that if they come in contact, that's deemed foreign to your body, like a fragment of a bacteria or maybe a molecule from a banana, is going to trigger inflammation. 70%, 70. Now we think of like our white blood cells in our bloodstream. That's only about 3% are in the bloodstream, okay? The rest are parked in your tissues, in your lymph nodes, your liver, your spleen, and 70% are wrapped right around that small intestine. So that's why any sort of leakage can trigger a massive amount of inflammation, okay? If you have fibromyalgia, that pain is from this inflammation. So you can feel it. Some people, it's just joint pain, achiness. They don't have like fibro in particular. But from a neurological standpoint, these inflammatory cytokines can get your brain, prevent your brain from recovering. So now you have post-concussion syndrome, or suddenly you've developed ADD. You've got some other autonomic problems like POTS. You won't fix any of this unless we fix this leaky gut. We've got to get the inflammation down in the body. And you can dance around with this or that, but you got to fix this. Now, it's not just SIBO doing this, all right? Now, I have this big schematic I show to my patients. And so here's the chronic inflammation. Here's things that drive it. Here's what we call overnutrition, so excess nutrients. Here's the autonomics and the vagus nerve not working correctly. Way over here are what I call my odds and ends. And here are the things that cause leaky gut. And we'll zero in on this. And it's basically, here's my list in my mind. SIBO is a major cause, major cause. Another very common cause that's happening right now is the post-COVID enteropathy. This is, you can find my other videos where I'm talking about the use of glutamine to fix that. SIBO, you need inulin or rifaximin, especially the rifaximin if you're older. Severe burns can do this. Well, if you've got that. Chronic HIV, untreated HIV infection is well known to do this. Now, many people, chronic psychological stress, work, home, imbalance, all that, being in an abusive relationship causes leaky guts. We're learning now various microplastics are causing leaky gut and increased inflammation. If you're getting chemotherapy or x-ray, this means radiation therapy. The radiation would have to be in the abdomen, but if you're getting those, they both cause leaky gut. And then what we call non-nutritive sweeteners. These are non-sugar sweeteners. So the artificial ones, as well as the natural type of sweeteners that are not sugar, natural sugar, whether it's fructose or glucose. A variety of them are now being shown to cause leaky gut. So what's the most common? Well, people have a lot of stress. That's part of it. The microplastics is part of it. We just don't know how to manage this or how prevalent that is. Now, obviously, chemotherapy, radiation, those are time limited. Get rid of the artificial sweeteners. All right. And these are the two that I really focus on as a clinician. Is I'm treating with SIBO, and really the majority of my patients now, I'm giving them a couple months of glutamine to heal up if they've had COVID enteropathy, and you won't even know if you did. Most people don't, but so we just go ahead and treat it, and that's a short-term thing. So that's how we're trying to adjust the leaky gut. And again, but getting back to it, you leak in here. This is 70% of your immune system. 70. That's why this is so critical. If doctors understood this, they would be taking SIBO much more seriously when they're dealing with an autoimmune disorder or just an inflammatory arthritis. And where is this inflammation coming from? That's where you start, right there. Okay, hope this has been helpful for everybody. We have a wide variety of other videos for you can search on these different topics. Don't forget to subscribe to get more of my videos in the future. Everybody have a good day.